One of the most common complaints in a urologist's office is about premature ejaculation. Generally, we treat this patient with medication. However, some techniques can be encouraged, some methods to manage this condition. Watch this video with me until the end, and I will explain what can be done. Hello everyone, welcome to Men's Health. The information presented in this video is based on the medical knowledge of a certified urologist, but is for educational purposes only, and does not replace a consultation with a healthcare professional. If you have any questions or concerns regarding your health, seek specialized medical advice, and let's get to today's topic. Premature ejaculation is a highly sought after, much talked about, and questioned topic in the office. I have a video here on the channel where we explain the definition, types, classification, diagnosis, and treatment. The pharmacological treatment is basically done with antidepressants. We have on-demand medications, the ones that the patient will use 1 to 2 hours before intercourse, such as duloxetine or Prosoy. And we have daily medications, which are tricyclic antidepressants and serotonin reuptake inhibitors, fluoxetine sertraline. But in addition to this pharmacological treatment, there are some tips, some methods that these patients can use to try to control premature ejaculation without the use of medication. First, pelvic floor strengthening exercises, Kegel exercises. These are related to intimate gymnastics or pomporismo. With these exercises, men can gain greater control of their musculature, both in the pelvic floor and at the base of the penis and the penis itself. Thus, they can have greater control at the time of ejaculation. It is important to remember that men tend to have weaker pelvic floor muscles, and this tends to worsen with age. I have a video here on the channel where a physical therapist explains how to do these exercises and their benefits, including in the treatment of premature ejaculation. Second, the use of condoms. Condoms can decrease the sensitivity of the glands, improving ejaculation time. In addition, some condoms may come with local anesthetics, such as benzocaine, which will also help with this issue. Another way is to practice concentration exercises, working on, for example, breathing, anxiety control, and yoga exercises. We know that premature ejaculation is directly related to anxiety and often to psychological factors. So, a patient who better trains their breathing or is able to do some exercise related to controlling their anxiety tends to have benefits regarding ejaculatory time. The other method is to use the stop-start technique, which is exactly interrupting sexual intercourse as a way to try to decrease your arousal and even lose some of the erection to better control the ejaculation time. We can also mention the squeeze technique. In this technique, the patient will be stimulated to squeeze their glands for approximately 30 seconds at the moment of their greatest excitement, close to ejaculation, to try to increase and improve this time. Another tip we can give the patient is regarding changing their position, finding a position in which they are less stimulated and less excited. In addition, the use of topical medications, creams, or anesthetic sprays. One commonly used is EMLA. EMLA is composed of prilocaine and lidocaine, which are local anesthetics. The patient will use it about 10 to 15 minutes before intercourse, and in this way, it will slightly decrease sensitivity. The major disadvantage of using these topical anesthetics is that they can often cause a very intense loss of sensitivity, leading to, for example, cases of erectile dysfunction, and also be transmitted to the partner. And then the woman may also lose sensitivity during sexual intercourse. These are some methods, some tips regarding behavioral therapy that the patient can use, in addition to pharmacological treatment. As premature ejaculation is a condition closely linked to anxiety, we often recommend psychogenic therapies, such as sex therapy, to these patients, and this can be very valuable. If you've made it this far, you already know that there are several techniques that help control premature ejaculation without the need for medication. But if in addition to control, you want more potency, more desire, and a firm and lasting erection, perhaps what is missing in your case is addressing the true root of the problem. There is a 100% natural method that takes only 7 seconds a day and has helped thousands of men regain confidence, firmness, and pleasure during sex. I've left the link in the description and also a QR code here on the screen. Just click or point your phone's camera to discover this simple but powerful secret that can transform your sex life, even if you've tried everything before. Take a look at the video on the page. It could be the first step for you to feel in control again, like in your best days. If you found the content of this video interesting, if you think it will add value for someone you know, please share this video. Don't forget to subscribe to the channel and activate notifications to stay updated on our weekly content. A hug.